Hi, I'm Kathleen Texera with the AGA, and this week the House of Representatives will move on healthcare reform legislation, and this represents Congress's final push to move healthcare reform, and the plan is to complete this legislation by this weekend. Now, there has been a lot of partisan wrangling on this issue and on the process of moving healthcare reform, and this process has literally been changing from day to day. And for more information on the procedural tactics that Congress will use to pass healthcare reform legislation, please check out the AGA Washington Insider, which is our policy blog, for more details on reconciliation. Now, despite the fact that this process has been so partisan, the AGA throughout this past year has been engaging both sides of the aisle to find a solution to pass healthcare reform that will be beneficial to gastroenterologists and their patients. However, having said that, the bill that the House will vote on this week, AGA has some major concerns with many of the provisions in this bill. First and foremost, this legislation does nothing to fix the broken Medicare physician payment formula, the SGR. It does not provide any type of reform for the SGR, which we feel belongs in healthcare reform legislation and is a real critical piece to it. Now, the Congress has recently passed a 30-day fix to the SGR and prevents cuts of nearly 22% from being enacted, and that goes through the end of this month. And the Senate recently passed another 6-month extension to prevent cuts from being implemented, and the House is expected to follow suit. Having said that, the AGA and all of organized medicine continue to press Congress for a permanent solution to the Medicare physician payment formula, and we will not support another Band-Aid temporary fix to the SGR, and we believe that this year, once and for all, Congress needs to enact meaningful payment reform, so we continue to push that issue. The other provision in the healthcare reform legislation that is very concerning to the AGA and all of organized medicine is that it contains an independent payment advisory board. Now, this independent entity would operate outside of Congress and would really usurp a lot of congressional authority over the Medicare program. And we are very fearful and have concerns that this entity would make additional cuts to the Medicare program and therefore to physician payments. So we are opposed to this provision. We've made our sentiments clear to Congress from the get-go on this issue. The other provision that is also very concerning to the AGA is that it establishes what's called a shadow RUC. Now, this provision would operate outside of the current RUC process, which establishes values to all of our payment codes, and this entity would also have the authority to deem codes overvalued and therefore recommend additional payment cuts outside of the RUC process. We have grave concerns about this unprecedented authority and the impact that it would have on many endoscopy codes. Now, again, this process will continue this week. The clock has started ticking on the process. We continue to monitor it, and again, it continues to change. Please look on our policy blog for more updates on this, and also in eDigest and on our website at www.gastro.org. Thank you.